Endometriosis affects a lot of women and it leads to painful periods. Typically what happens is the uterine tissue, known as endometrial tissue, is growing outside of the uterus. This can happen around the ovaries, the fallopian tubes, the intestinal tract. In extreme cases, can even be anywhere else in the body. I've had clients have endometrial tissue grow on the diaphragm. The endometrial tissue is supposed to be contained into the uterus, and if it is not, we are dealing with endometriosis. Endometriosis often comes with very, very painful periods, painful ovulation as well. Very heavy uterine bleeds as well. During menstrual flow, we can have very heavy periods. There is no for sure cure, but there is a lot of treatment and management that can help with endometrial symptoms. How can pelvic floor physiotherapy help with endometriosis? First thing we do is we help manage symptoms. And as a pelvic floor physiotherapist, I help teach people what they can do at home to help self-manage those symptoms. We'll talk about the castor oil pack. We'll talk about breathing techniques, simple stretching exercises. We'll talk about how to maybe modify a little bit activity levels around cycle time to match the energy levels that typically accompany certain hormone changes that come along with menstruation and ovulation and all the other phases of the menstrual cycle. We'll also talk about hands-on therapy that can be done. I'll do a lot of abdominal soft tissue work as well as internal pelvic floor muscle work, just to help loosen off those tight muscles that often become very tight and restricted when we are dealing with pain. I also offer acupuncture as part of my treatments, which has been paramount for so many of my clients who are dealing with endometriosis. Pain relief extraordinaire.